Hello, folks. My name is Michael or Jiachun. I'm a podiatrist from Australia, Sydney. I have over 10 years of hands-on experience in skin and nail surgeries. Today, I would like to give you guys a brief talk about onychocryptosis, which is known as ingrown nails. Without further ado, let's dive into it. So just a quick overview of today's contents that we're going to cover. So our topic today will cover the etiology of ingrown nails, surgical interventions, surgical risks and contraindications, and of course, finally, the post-op wound care and the wound recovery time frame. So first and foremost, what is a ingrown nail? Simply, as the name itself suggests, it means the nail edge impinges or grows into the flesh. As this happens, a ingrown nail piece acts like a foreign body, causing the nail edge or skin or nail sulcus to become red, hot, swollen, painful, and purulent. There are many factors could lead to this. Hereditary predisposing risk factors. That will mean if your parents or grandparents have ingrown nail condition, you are then more likely to suffer from the same problem. Some patients are born with wider nail plate or involuted nail plate. Those nails are also termed as omega-shaped nail. As you can imagine, at what level of risk will you develop ingrown nail problem if you take off your shoes and socks and surprisingly notice that you have one of those shaped nails? Moreover, external trauma, injury, or chronic fungal nail infection or onychomycosis can also result in permanent nail thickening and nail deformity or dystrophy that can also lead to ingrown nails. Finally, but not the last, sport activities such as soccer, inappropriate tight shoes, or even wrong nail cutting techniques, i.e. cutting your nails too short, can also lead people to develop ingrown nails. Ingrown nails are common foot pathology or problem. When this problem is only mild, your doctor or podiatrist can simply use a nail clipper or ingrown nail tool such as beaver blade to easily remove the sharp nail spicule. That often brings you an immediate pain relief. However, if a ingrown nail infection is severe, or if this problem becomes a recurrent problem or issue, your podiatrist can perform a further close examination. If the cause of the problem is wrong nail shape or nail deformity, surgical intervention can be considered. Before going ahead with explaining to you the surgical treatment, let's touch base on some basic nail anatomy and pathophysiology knowledge. The germinal nail matrix located at the very proximal base of the nail. It hides under the eponychium, and it extends about half centimeter approximately towards the interphalangeal joint. Germinal matrix means the early stage of development, i.e. embryo. In Chinese, it means the mother. Because to a certain or great extent, the germinal nail matrix really detects how your nail will be grown, in what shape, thickness, and at what speed. The cross plane of the human finger again illustrates the location and the orientation of the germinal nail matrix. A question I often encounter from my patient is that, "Hi doctor, I had my toenail completely pulled out in the past. How come I still develop a ingrown nail?" Pulling out a nail out brutally is indeed very easy to perform. However, it doesn't really address the ingrown nail problem in a long term. As the nail plate is just being simply pulled out, the germinal nail matrix cell is still left behind, alive and active. What does that mean? Yes, your nail will continue to grow back slowly. Approximately in 9 to 12 months, the nail plate will fully grow back. Not surprisingly, it often doesn't behave, and it often head into the wrong direction, just like it did before. So here again, a red painful toe. Without proper treatment, a patient can often have ingrown nail problem intermittently for years. Antibiotic treatment almost becomes their best friend. The impact of an ingrown nail on people's daily activities of living is dramatic and tremendous. It is not uncommon to hear people say, I have to take days off work because of an ingrown nail problem. Others may have to avoid using a blanket to cover the foot during the evening rest or sleep to simply avoid foot pain. Therefore, to solve the ingrown nail problem completely, the germinal nail matrix cell must be interrupted, deactivated, or destroyed. Pediatric surgical intervention is often very successful. The surgical procedure is called partial nail avulsion. In this procedure, the ingrown nail matrix will be removed. The germinal nail matrix will be destroyed either by chemical ablation or surgical excision or removal. Procedure 1. Chemical ablation or phenolization. This is a procedure that is performed under local anesthetic. The procedure is a minor procedure and only takes about half hour to perform. Before the procedure, local anesthetic injection is slowly and gently given at the bilateral side of the toe. Once we confirmed your toe is completely numb, we will surgically remove the problematic ingrown nail piece. Please note that ingrown nail we remove only contribute to 15 to 20% of the total nail plate. After the piece of evil nail is removed, we will carefully check to ensure there is no leftover nail piece left at the nail sulcus. And then we will apply some chemical along the exposed nail bed and the germinal nail matrix. Only by doing this is the germinal nail matrix cell destroyed permanently. Since this happens, this section of the nail will not grow back, hence the ingrown nail will not reoccur again. Procedure 2. Vinograd. In comparison to the chemical ablation, the Vinograd procedure enables the surgeon to remove the germinal nail matrix surgically with a blade. After the surgical excision is complete, sutures or stitches will be deployed or applied to close the wound gap. Both procedures serve the same purpose, that is to bring an end to an ingrown nail problem. The two procedures we have mentioned above carry the following advantages. There are both minor procedures that could be easily performed in medical centers or pediatric clinic settings. They both performed under local anesthetic, meaning there will be no private hospital admission, no hospital overnight stay, no general anesthesia, so it is a cost-efficient solution. A local anesthetic can also be adjusted and mixed with other solutions, and it is injected very slowly and gently. That is to reduce the pain and discomfort associated with the injection process. Due to the fact only a small part of the nail plate is removed, the surgical site has minimum surgical invasion. That also means the wound will have a reduced risk of uncontrolled post-op active bleeding. Moreover, the wound will have a relatively quick recovery, considering the size of the wound. The top advantage of the procedure is, however, the long-term benefit. Research shows that about 95% of patients who undergo this procedure will not have an ingrown nail problem happen again. The promising high success rate is an important reason why so many patients choose the surgical approach to end their pain and frustration. Before we perform any invasive procedure, a comprehensive foot assessment is always critical. As we create a surgical wound on your foot, it accompanies risks, which may include post-operative pain, bleeding, infection, and delayed wound healing. And of course, approximately 5% of inguinal reoccurrence risk, as we just mentioned in our previous slide. We will go through a detailed medical history taking before any surgery is taking place. Chronic health conditions such as poorly controlled diabetes, high blood sugar or hyperglycemia, cardiovascular disease such as recent heart attack history, bleeding or blood clotting disorder, peripheral artery disease, or poor blood flow on the lower limb are all contraindicated for any invasive toenail surgery. We have to factor in those risks and weigh their benefit very cautiously and carefully before any invasive podiatry treatment is taking place. We can use podiatry Doppler machine to check the blood flow on your foot. That is to ensure your safety. If your blood flow on your foot is simply excellent, that would indicate it is more likely after the surgery you will experience a smooth wound recovery process. Nothing is 100% per se. However, your neurovascular status definitely helps us to better predict your clinical outcome and wound recovery progress after the surgery. We will also check your medication and allergy history. Again, that is to ensure your safety. For the first 2 weeks after your toenail surgery, you should visit your regular GP at least twice a week for wound review and dressing change. In the first 2 weeks after your surgery, please avoid extensive running, jumping, and swimming activity. Likely, after 14 days are passed, you will have minimum pain at your surgical site. Please follow up with your regular GP and listen to their instruction. You may be able to perform dressing change tasks at home yourself. If we have applied chemical phenol to the germinal nail matrix, we will certainly clearly inform you. Please be aware, due to the minor chemical burn, your wound site can secrete some watery or light yellowish color wound discharge, and this can carry on for about 6 to 7 weeks from the day of the toenail surgery. That's all, folks. If you guys have any questions, please feel free to drop me an email. I will be more than happy to reply.